Hello, I'm Dr. Bornali Datta. I'm a pulmonologist working in Medanta, the Medicity. Now, the main topic that I want to address today is about providing support and counseling to patients who present to us with tuberculosis. All of us as doctors are good at prescribing, we know the medicines to prescribe, but what has to accompany the prescription is support and counseling for the patient and the family members. Now, first of all, remember that every time you give a diagnosis of tuberculosis, the patient panics, and that is a very normal response. They think, how can I get TB? Very important to tell them that, look, it is a fully curable disease because it is an infection. You will recover, but you must take the treatment for 6 to 8 months, whatever is prescribed by your doctor. If you stick to the treatment, adhere to the treatment, complete the treatment, you will recover completely. These words provide a lot of assurance and confidence to the patient. Apart from this, it is important to tell them what side effects to anticipate, both physical and mental, so that they are prepared for it, and also to give them an option of who to contact if they do develop these side effects. It is important to put them in touch with survivor groups. There are networks and support groups, survivor groups, so that will again boost their morale, give them confidence in a difficult time. Last but not the least, there is a lot of stigma attached to it, and it is again our duty to explain to them that there will be stigma and to give them mechanisms of how to cope with it and to explain to them why they should not stigmatize themselves from their own perspective, and then it is important to explain to their family members to look after them. Now, it is a very common thing. I see a young woman in patient and I tell her, you've got tuberculosis. And the question is, how can I get tuberculosis? I live in a good community, in good apartments. How can I get it? Now, the point is anyone in India can get it. Why? Because we are a country with very high incidence and prevalence of TB. So it is not uncommon for anybody can develop it. So I think, it's important to, again, explain to the patient that, look, you do have tuberculosis, but it is curable. You will recover. So don't worry. And I will help you. I will guide you. Apart from this, as we discussed, put them in touch with other groups as possible. Now, a few other things. Spending a couple of minutes just telling the patient, giving them that support, explaining a few things around it can dramatically influence their treatment-taking behavior, their adherence to therapy, their completion of therapy. So just 5 to 10 extra minutes in the counseling, in the consultation, can actually ensure that the patient completes the treatment. So that's important. Family members are important people, and a family member can be a buddy to the TB patient. Again, he can play a significant role in improving adherence, compliance, and ensuring completion of treatment. So this is important. So if we as doctors can take 10 to 15 minutes time during our consultation to counsel the patient, the family, to give them the real facts around TB, not this misinformation that floats around, to give them proper information and guide their thought process, guide their treatment, and ensure that they are able to adhere to the treatment and complete it with full support from us. Remember, if just treatment for TB was enough, then thousands of patients would not stop their treatment midway. It needs more than that, just the drugs. We need to have a system of ensuring adherence, of ensuring support and counseling to the patient so that we can guide them through the entire journey. This begins with you and me.